Love your gut.
So it's a very interesting concept that you have right here. The name Cafix, it suggests the entire concept that you have, but I never gave it a thought. So you have a coffee place or a cafe here?
Actually, when we say Cafix, the first 3 letters are for coffee and the other 3 are for fix.
Fixing, correct, correct. So I never thought about it in that way. So you have a cafe or a restaurant or where you serve food and great coffees, and you fix things.
Yeah, that's right.
So can you tell me how you came about building this place and how this entire concept came in place?
Okay, it so happened that whenever you buy an Apple product, the services part become very expensive.
Right.
The moment you break the screen, or probably there is a fault in your MacBook and stuff.
Right.
So that's where we come in.
Right.
We do it at at almost 30% of the cost.
Right.
And with the same components that are with Apple.
Right.
And Dr. Suril, you are a surgeon.
Yeah.
What do you specify?
So I am a gastrointestinal surgeon. So I do surgeries on the GI tract. So everything that goes in your mouth and comes out of your body. So till then, whatever organs are involved, so esophagus, the stomach, the intestines, the colon, the rectum, the pancreas, the liver, the gallbladder, the biliary system, everything. And we are surgeons that deal with the digestive tract, the complicated diseases of the digestive tract and the cancers of the digestive tract.
What are the most normal cases that come across?
Most commonly so if you ask me, the most common cases that we deal with are gallbladders and a lot of hernia surgeries that we do. See, as a GI surgery as a branch, it is kind of, if I tell you what a GI surgeon does, most of the people are going to tell me, I have gas, I have constipation, and so that is why I need to consult you, which is not what I do, right? So gastrosurgeon is gas. I go to various places, a relative's place or functions.
I got it.
मुझे gas बहुत होता है, but मैं वो नहीं करता. That is not what I do. So it is slowly evolving. We are a subspecialty of the general surgery, which got detached from general surgery, because general surgeons are the surgeons who will do anything from head to toe, right? So we got detached from them and we learned more about only the
specialization.
The subspecialization, and now we are more subspecializing into organ-specific treatment. So we have a team of 3 GI surgeons. So one of them, we are subspecializing into liver and pancreas surgeries, colon and rectal surgeries, upper GI, bariatric surgeries, all those things we are specialized. So one guy will keep on doing that only, because that also, over the period of time, we have realized that each organ demands extreme attention. Only then you can give it a more proper treatment or more justice to the disease that the patient is having. And it is a very complex system that we deal with. So it has food, it has inherent bacteria, it has all the feces that you excrete out, it has hormones, right? It has hormones secreting into the intestines, it has hormones secreting into the blood, right? So inherently infected system that we have to get back on track. So you understand how complex it is, right? So so it is evolving slowly and people are getting to know about it more and more, but I hope we will be there somewhere where people see us as GI surgeons who deal with diseases, not gas.
Now with the beauty industry coming up so much, what do you do on those cosmetic surgeries?
Cosmetic surgeries, we don't usually deal. I mean, there are subspecialty of GI surgeons who are into bariatric surgeries, but bariatric surgeries itself, they are not per se to look better or to look leaner. So it has more of health benefits. So there are patients who are uncontrolled diabetics, there are patients who are hypertensives,
all because of obesity.
Correct. So if you are 150 kilos, then no medicine is going to help you reduce the blood sugars. So at that time the bariatric surgery comes in.
It makes sense.
Right. So that is it used to be perceived as a cosmetic surgery earlier, but now it is more of a health benefit that you...
I have a personal question.
Yeah.
There are lots of gut benefits which you come across on Instagram a lot.
Right.
Do they really help?
So you're talking about the gut
cleansing and
correct. So,
liver cleansing and
liver
stuff
cleansing,
like
yeah.
that.
So I would not take everything as they say, but there are certainly, that how bacteria are there in the gut, which helps us to digest the food that we eat.
That's right.
Right. So they are good bacteria.
So
right?
anything which is natural and you would recommend?
Natural as in you eat more fibers.
More fibers.
Yeah, more fibers are going to always help
So
your
salads.
gut. Yeah, salads and more seeds, dry fruits, all those things, fruits, right? So all those things are going to give you fibers. But then there are cases where you deplete. So there are cases where patients have had a long term of antibiotics for some chronic disease that they suffer of. So or there is a sterile gut syndrome that people have, the alcoholics especially, right? So all those people, they wash out the good bacteria as well, right? So in them there are products which are available commercially and by prescription, which are going to help them regenerate the good bacteria that they have. Right, so those products are helpful for such people. Now, if you are healthy, completely fine, you're eating and drinking well, and you don't have problems with your gut, then if you keep on taking such good bacteria, I don't think they are going to help you much.
Anymore.
Yeah.
How do you rate two drink philosophy?
The alcohol.
Yeah, alcohol.
So as a doctor, I don't think any amount of alcohol is good for you.
Good for it.
Yeah. So
so no two drinks. Also.
Not really. How much that is going to affect you, that really depends on your own metabolism.
Right.
The health of your liver and your kidneys as well, because liver is the place where you are going to metabolize everything. Kidney is the place from where you are going to excrete everything.
So no drink is best.
Obviously, yes. Not drinking is the best policy.
Oh, nice. Doc, we serve some good coffee.
Really? Yeah. What all coffees do you serve?
We have a lot of specialized coffees.
Okay.
But I would want to take you through one of them.
Okay.
What sort of coffee do you enjoy?
So I, drink cappuccinos every day. I have a brewing machine at home, espresso machine at home. And I've been drinking coffee since 2012.
Whoa.
So I left. I used to be a very passionate tea drinker before that. Then I moved to US, and tea became a sort of.
You did your studies in US?
Yeah. So I did my master's in public health at Mount Sinai School of Medicine in New York.
Okay.
Then I came back for my surgery and further training to India. So at that time, we had Starbucks in our school.
Right.
So we used to carry this, coffee mug that Mount Sinai gave to us.
Oh.
So with that mug, Starbucks will give me one free coffee every day.
Oh wow!
So that is, how addictive Starbucks is, right? So it's really high caffeine content, exactly. Right. So that is what got me addicted to coffee, and then I've never left it since. So it is like an eye opener for me. So I drink cappuccino. So maybe 2 or 3 espresso shots in the morning.
In the morning. Oh, is it?
Really?
Oh, nice.
So what sort of coffee are you going to?
We have a lot of specialized coffees, but what I wanted you to have is Americano, cold Americano with orange. So that's a very special thing that we serve.
Yeah, I've never heard of it.
No sugar, so there is nothing artificial that goes in.
Wow.
And yes, I would like
to. It is going to hit?
Yes, definitely. Yes.
Right. So I see a lot of tech around here. So the entire coffee shop or the entire café is filled with tech. You have robots moving here and there. You have Macs and iPhones lying here. So I'm really curious to know what all goes.
So there are a lot of people who come here and ask, what did you start first? Did you start the tech first or the food first?
Right.
But then this is the way it was from the day one. So we wanted people to come, have the experience of a great experience of buying a phone or buying Apple or getting it repaired in an environment which is so much fun.
Right.
So there are people who give their phone and do their meetings here, people who come here. So that sort of an environment is what we wanted to make.
Right.
And that's how we carry forward all the tech. So probably these tables are basically computers. There are screens inside.
Really?
Yeah.
Oh,
So you can actually sit there. There's a
so
huge
is it like
screen.
a Microsoft Surface kind of a thing?
Something similar, but on an Android based, which is
Okay.
so you can serve food there. You can have people can play games.
Can you order also from there?
Yes, you can.
Wow. Wow. That's a really high-tech cafe that you have here.
Thank you. This is what I was talking about.
Wow. So you don't have people bringing coffee for you
No, it's served. Food is always served like this.
on the robot?
Yeah.
Wow. Thank you. This is the coffee that you wanted.
This is the
to try
coffee
out.
that I mentioned about.
Wow.
It's got no sugar, very organic.
It really does not have any sugar.
No sugar.
I
Nothing.
feel a hint of something sweet. This is the orange.
It's orange.
You cracked it for me.
So it's all organic and it's all gut friendly.
Very much, I can say. So, which coffee beans do you use?
These are coffee beans which we import basically. So there is a vendor whom we get it regularly from. He's in Bangalore.
Okay.
And, yeah.
So, do you import your beans or you grow that in India? I mean,
No, these are not Indian beans.
These are not.
import
Okay.
beans, but
okay.
We get it from somewhere in India.
Oh, okay, okay. So recently I visited Kurg
Right.
and I stayed in Evolve back. So they have their own coffee plantations and so huge estate, right?
True.
So they educated me a little bit about coffee. And since I've been into brewing coffee since a very long time, I was also keen on understanding everything,
how
right?
does it
So
work.
yeah, so they told me there are two main types of coffee: Arabica and Robusta.
Robusta. Yeah.
They grow in India. There are two places. One is Kurg and one is Chikmagalur.
Right.
So Chikmagalur grows Arabica, which is that they say that it is the best coffee.
Right.
Robusta is slightly milder, lighter brown version of coffee and lower in caffeine.
Right.
I don't know.
Yeah, that's
is
true.
Is it true, right? And Chikmagalur, I drink Sleepy Owl.
Okay.
So Sleepy Owl, I've been ordering Sleepy Owl since the last 4-5 years. And see, Sleepy Owl is sourced from Chikmagalur. And they have 100% Arabica. And Chikmagalur is the place, it's interesting. The history of coffee in India starts from Chikmagalur.
Chikmagalur.
You know that? There's one guy from Yemen. And this Yemeni guy, it was not allowed to bring coffee out of Yemen in those days. So he had to smuggle 7 coffee beans.
Oh.
So he smuggled those coffee beans in his beard and his chest. He hid it somewhere. He brought it to Chikmagalur and started growing coffee in India.
Coffee in India. Whoa.
This is about 1700s.
Interesting story.
Yeah, I know. His name was Baba Budan or something like that. I don't remember correctly, but yeah. Budan Coffee is also there's
there's
one
a
company, right?
brand there.
Yeah.
That's
So I guess they have the name from there.
How do you rate this one?
11 on 10. I mean, I was going to ask you for this recipe so that I can brew it at home every day.
Patented.
Patented it. So, how the robot brought coffee for us, it was really fascinating. I've never seen this. I mean, I've seen this in YouTube videos where they show China and, Chinese robots working for people. And Chinese are big in robots. I mean, there are robots everywhere, even in hospital settings where they have robots to work for people. I mean, work instead of people.
Instead of people. Yeah,
Right?
that's
So
right.
the hospital staff, half of them is robot, half of them are human beings.
AI and robotics is going to take a great way in the next generation.
Exactly.
How do you use them?
So there is a surgical robot. Are you aware of it?
I am aware of robots, but
Right.
I don't understand surgery as much.
Okay.
So but I can understand that a robot, you guide them to.
Yeah.
please.
So what happens is, when you hear about surgical robot, people usually start thinking that there's a robot which is going to do the surgery, right? So it is not like that. So what we use is a surgical robot that it is basically of 3 parts, right? So one part has the hands, right? So it is a much larger version of what we just saw,
Right.
right? So there are 3 parts of the robot. One is for the patient, one is for the surgeon, one is for the supporting staff in the operating room.
Oh,
right. So it has 4 arms. So we sarcastically call it Chaturbhuji surgery, right? So four arms, right? So 4 arms are there, and one is for the camera, and through which I see, and the 3 are the instruments.
oh,
Right. So and I put some 8 cuts on
Inside.
patient's body, and I put the robot inside, and the entire thing is controlled by me, which is sitting at some distance from the patient.
oh,
Right. So the patient is lying there in the OR, and I'm sitting about 10 feet away from the patient, and I'm controlling the entire robot from there. So what it does is, first of all, it is very small cut to the patient.
So healing becomes faster.
Yeah. So and also because of smaller cuts, no pain.
No,
So you
lesser
recently
pain.
got operated,
Yeah,
right?
yeah.
So you have been operated for a spine surgery, is what you told me about,
2
right?
stitches.
2 stitches, right? So why you went for it? There are surgeons
Who will cut it
who would cut it open and then fix it, but you went for 2 stitches. Why? Because you felt like 2 stitches is going to cause less pain.
Less pain.
So it's the same concept here.
And with the robot, it becomes more precise to do the surgery.
Very precise, very precise. So what robot has is a 3D vision. So whenever you're watching TV, it's all 2D, right? This phone is
Right.
2D, so you don't have the depth perception.
Right.
So the same thing used to happen earlier as well. So with laparoscopic surgery, there was a 2D vision, the
2D vision.
no depth
Yeah,
perception.
I got it.
This is like inside. I mean, I'm sitting inside the patient's
Oh, wow.
abdomen, and I'm having the things around me, and I can do whatever I want, and it is so fine. Like the instruments are in mm's, the terminal part. So it is so fine. If I touch here, it is going to only touch here, nothing else.
Oh, wow.
Right? So there is no collateral damage. There is no loss of precision. No nothing,
Nice.
nothing like that. So it is very precise. Wherever we want to go, it moves like a snake.
Oh, wow.
Right. So
Phenomenal.
it's a beautiful piece of technology that we have,
that we use.
and somehow I've been associated with technology since I was a child. So my dad got me a computer in 1996-7,
I can understand it.
right? So a lot of people around me who know me since childhood, they are still surprised how Suril became a doctor, because we always saw him as a tech guy.
Tech person.
Right.
Oh, nice.
So maybe this is so fascinating for me that I am able to understand it in much
Better
much more
terms.
depth. Yeah,
I know, I
much
can
better terms.
Only because you started learning about it.
Yeah, exactly. Nothing to do with promoting it more, or being so vocal about it. But I just think it is the such a great invention by the human race that it is going to benefit a lot.
So use it to the maximum.
Correct.
Okay, I heard that in insurance you're not not fully paid when you do a robotic surgery. Is that true?
Yeah, that depends on company to company. I mean, not every insurance is the same. So that now the insurance have started adding robotic surgeries to their
So basically,
list of
when I
surgeries.
take my insurance, I should make sure that
Yes,
the
yes,
robotic
yes,
part
yes.
is covered into it.
Correct.
Oh,
So I am
nice.
renewing my insurance this month. So that is what I made sure that and the companies are pitching it like that.
Achha.
Now, that was the new thing for me. I was talking to my friend today,
Right.
and I told him that companies now are pitching that if you take this insurance, you pay this premium, and
Nice.
you will get the robotic surgeries included in this one,
Amazing.
right? So they are doing their part. We should do our part.
When I
Just
was
give-
to do my surgery, they asked me. So I said, there's nothing.
Yeah.
Insurance covers it or doesn't cover it. Did not.
you go for the
I just
least.
go for the best.
Right, exactly.
That's
It's
how
our
it
body,
works.
right?
Yeah, it's our
Right.
You don't get it every time. Unlike a phone where you can buy it every
exactly.
2 years, you get a new one. You can't get that one.
You cannot even get it repaired once you damage it.
Exactly,
to the max,
to an
right?
extent.
Right.